Well, a warm welcome to today's talk, Saturday the 29th of October 2022. I want to do a bit of a COVID update today. Now, before we look at the international situation, which is basically fairly encouraging, we're certainly moving into a period of endemicity. But before we do that, I want to look at the clinical features that people are reporting this week. So these are people that have diagnosed positive. They've actually had a positive test for COVID, having become symptomatic. And this is the proportion of symptoms that people are getting. So if you're diagnosed positive with COVID, there's a 62% chance you'll have a sore throat, 53% chance you'll have a headache, 53% chance you'll have a blocked nose or a runny nose at some stage in the infection. Cough with no phlegm, 52%, so just coughing but not bringing anything up. Sneezing, 47%. Cough with phlegm, productive cough, 45%. Hoarse voice, 43%. Muscle pains and aches, 28%. Fatigue, 22%. Dizzy and light-headedness is 21%. So we see that these are very classical common cold features and very difficult to tell the difference actually without a test in most cases. Altered sense of smell, 20%. Swollen neck glands, 18%. These have been quite persistent, the swollen neck glands. Chest pain, tightness, 16%. That's not normally really associated with the common cold, so there are some differences. Sore eyes, 16%. Shortness of breath, down to 16%. This is really important that this one's down because, of course, shortness of breath is one of the main reasons that people were hospitalised throughout the COVID pandemic. So good to see that that one's well down. Loss of smell, 16%. Earache, 15%. Joint shoulder pain, 11%. And chills or shivers, 10%. So they are the features that people are suffering from. Now, we're still not minimising this. In the UK, there was 825 people died last week, or the last 7 days, data as of yesterday, within 28 days of a COVID test. So we're still not minimising this, but for the vast majority of people, we've got a presentation that's similar to a common cold now. For the majority. Now let's just look at some data here. This is the international situation. Now these are confirmed cases. Now these are basically, there's so little testing it's not worth spending time on these really, but that's the figures there. But all of the official testing rates are currently pretty low. Hospital patients, of course, is a much better measure. So these are number of COVID-19 patients in hospital per million people. And the United Kingdom is highest, although we just have seen a bit of a downtick in the UK. This green line here is the United States, which, of course, was very high. So remarkably good news to see that the number of hospitalisations in the United States is well down on what it was, because more and more people are developing immunity in the United States and getting less severe illness. Still some problems in the United States because there's so many comorbidities. So not saying the problem's gone away, but certainly, as we see from this graphic, much less than it was, and good to see that Australia's bottom of the pile there. Now, these are deaths. Now, the United Kingdom, the deaths here in the United Kingdom, of course, are there's been a data drop out here. So the United Kingdom's probably about highest at the moment. United States, Ireland, Australia, Netherlands, in that order for number of people dying of COVID-19. Now, of course, we can't do direct comparisons because different countries are testing. Obviously, different countries are testing differently. But anyway, let's go on and look at some more Zoe data. Now, this one here is really quite interesting. This is the people with common colds in orange and people with COVID colds in blue. So we see that if you've got common cold symptoms, as we've just looked at in the UK, it's more likely at the moment, well, considerably more likely that you've got a common cold rather than you've got COVID. But we do see that both of them are coming down at the moment. Now, these are the new daily cases in the UK. Thankfully, we see these are coming down as well. We haven't gone anything like these previous Omicron peaks that we were worried about. So this is pretty good news. And the only thing that explains this to me really is increasing community immunity. This is the extrapolated data for the number of people in the United Kingdom who would have COVID. And again, we see that mirrors it very accurately and the numbers starting to come down. Not saying it's going down quickly, it's kind of drifting down slowly, but it is going down, which is good news. This is symptomatic COVID, of course. Across the UK home nations, now we have fluctuations. Now there's a fluctuation here where Northern Ireland is much higher. But the problem is that there's not many people putting in the Zoe data in Northern Ireland, so you tend to get more fluctuations because there's a smaller overall number. But basically we're seeing that the pandemic is equally affecting all of the UK, is why I'm showing that slide. Much the same for the English regions. We could point out some differences here, but basically this is affecting all of the country in much the same way. Age ranges is interesting. So this blue here is the younger age group, so the 0 to 17s here. So they went back to school, got lots of infections, developed some immunity, but now they're picking up again in terms of COVID, as are the 18 to 34s. So we are seeing some increase to some levelling off in the younger age group, in under 34s. But thankfully, in the more at-risk age groups, we're seeing a significant reduction. So the red there is the 55 to 74. The purple there is the over 75s. And their incidences are going down, that they're having less. And of course, this means that in the next few weeks, we're going to have lower amounts of hospitalisation because these are the more at-risk, significantly more at-risk populations. Long COVID, this is basically rising and falling with the incidence of COVID here. But of course, the data scientists and Tim Spector last week that we talked to do point out that this is based on risks that were estimated in 2021. So this is a worst case scenario, but I think we can say that some people are still developing long COVID. I think we can still say that fairly safely, and that's consistent with ONS data as well. This is people with common colds that aren't COVID. And again, we can see it went up and down in younger groups, but slightly lower down now altogether. So thankfully, hopefully less people sniffling in the UK at the moment. And that was that end slide of that data. So very interesting. I put the link to the whole report all there. Gives us a prevalence in the UK at the moment of about 1 in 24 from the Zoe data. Download the full report. Anyway, moving on to the Office for National Statistics data. 1 in 24 symptomatic. The ONS data, which is more behind the times, is showing about 1 in 30 people currently infected in England. Now, this is based on survey data, so this is accurate. So we see that in England, this will be up till the end of up till last week, 1 in 30, 1 in 35 people with COVID. So we still see there's actually a very high prevalence. Plenty of people still have COVID, so there's a lot of it around, but thankfully less people getting ill. Again, consistent with my argument that we are moving very, very much into the endemicity period, and this is going to go on for some time. In fact, pretty soon we won't be reporting this data because it won't matter too much, but it's interesting to look at it, seeing it's all still available. England cases, percentage testing positive, levelling out, and next week we can say with some confidence that that will be down a bit, again based on the Zoe data, and I'm hopeful it's going to keep going down. So in terms of COVID this winter, I'm less worried than I was, well certainly way less worried than I was at this time last year. The big unknown, of course, is how many people are going to get influenza. That's still the big unknown at the moment. Now I just want to show you some ONS data here. This is pretty interesting. Now what this graphic here is doing, it's a bit complicated, but I think we can work it out. So what they're taking here is this line here is the sort of reference line, and this is the COVID-19 vaccine status, and this is referencing people who've had 14 to 18 days after their third dose of vaccine. So that's their line there. So anyone on this side is more likely to get infections than these people who've had, in terms of getting infections. It's not saying how sick they'll get. Anyone on this side is more likely to get infected, and anyone on this side is less likely to get infected. So we see that everyone is more likely to get an infection or a reinfection very often after, compared to people that have been vaccinated within 14 to 89 days. So these are people that are unvaccinated here. That's their risk. So they've got a slightly increased risk. But what really grabbed me about this is more than 90 days after the second vaccine, you've actually got a higher incidence of reinfection than you have if you're unvaccinated. And more than 90 days after the third dose of vaccine there, you've actually got a higher risk, nearly 2 times the risk, not quite, but about 1.9 times the risk, as opposed to just about 1.1 times the risk if you're unvaccinated. So I had my last vaccine, self-disclosure time, I had my last COVID vaccine on the 27th of October 2021, which of course is a year and 2 days ago. So that means I'm actually now more at risk of getting reinfected than if I hadn't been vaccinated, according to this data, with reference to people that had the vaccine 14 to 89 days ago. Interesting. Interesting. We'll leave it at that. Now, self-reported long COVID. Quite a lot, really. 2.3 million people, 3.5% of the UK population. 80% of this 2.3 million symptoms for at least 12 weeks. 40% at least 1 year, 22% at least 2 years. So quite a lot of people with long-term, ongoing long COVID. This is a problem. Fatigue, difficulty concentrating, shortness of breath, muscle ache are the most common features. And it affected day-to-day activity in 1.6 million people. That's 72% of the 2.3 million. Now, I personally know several people, of course, who are suffering from long COVID type symptoms, and you will as well. The situation's pretty similar in the States. So there's no question that this long COVID is a serious issue. If there's anyone out there who doesn't know anyone who has long COVID problems, do let me know, because I think most of us have got quite a few friends in that category at the moment. And other issues as well. I'm curious to why my blood pressure went up last year. I'd had low blood pressure all my life, and then it just went up all of a sudden, and I'd start blood pressure meds. You just get the feeling it was such an acute change. Could that have had a specific cause? Did my diet change, for example? Not that I'm aware of. Am I doing less exercise? Well, not as much as I'd like to, but it hasn't really changed. So you just get the feeling there's questions to be answered around the country. Anyway, now this graphic here, we've been keeping an eye on this. This is very interesting. People admitted with COVID to hospital or for COVID. So did they just happen to have it when they were admitted, or were they admitted for the purposes of COVID? And what we see is the majority. So this is the 50%, that's 100%. So we see that the majority here were admitted coincidentally with COVID. Although we do see the amount that are admitted for COVID has increased slightly. Didn't get a precise figure on that. Looks about 40% to me. So we can say that in rough figures, 60% of people with COVID in hospital, it's coincidental. 40% it's for COVID. That's good. And of course, some people contract COVID in hospital, of course. Acute care, intensive care situation. That should be ICU, really. Intensive care unit. So here we see that's the 50% there. That's the 100% there. So we see that most people here admitted to intensive care who have COVID, most of them it's an incidental finding. Now this is really good news, because it means there is very few people being admitted to intensive care for COVID. Completely different to the peak of the Alpha or Delta, for example, particularly the Alpha. Now, excess deaths. Now, I've got more to say on this. I'm going to do in a separate video, because this just seems to be everywhere, but excess deaths, not quite everywhere. Europe, the United States, less so, actually, at the moment, although they've had a lot of death. Now, the thing is with the excess deaths, you'd actually expect deaths, given that a lot of the vulnerable people have died over the pandemic, sadly, from COVID, and other conditions, for example, not being able to access medical treatment. You would expect most of the vulnerable population really not to be with us, sadly, anymore. So you'd expect, I would expect, I'm sure you would expect, the excess deaths, the deaths above the 5-year average, to be less than expected, because the vulnerable population has largely passed away. The opposite is what we see. So in the UK, deaths registered for the week ending the 14th of October, 13,253. Not surprising, sadly, people die. We are a transient population on the surface of this planet, of course, and this is what we expect. But from years of data, we know roughly how many people should be dying, and we are way above that. 14.9% above the 5-year average, 1,719 excess deaths. Now, why this isn't being talked about, just imagine that there was a terrorist strike or some tragedy or a natural disaster, a tsunami or an earthquake in the UK, and 1,719 people had died. The press would be all over that like a rash. And on these excess deaths, you hear virtually nothing on the mainstream media. Suspicious people would become suspicious as to why they're so silent about it. Or just imagine there was a road traffic accident where 1,000th of that died and 17 people died. They would be all over that like massive coverage. But yet 1,719 people have died who we wouldn't expect to die in the UK. And we hear essentially diddly squat from mainstream media. This is very surprising. And deaths involving COVID-19 were only 4.7. Well, I say only 4.7. But we know quite a few of those were deaths with rather than from. And I'm just going to show you the graphic from the Office for National Statistics on this. This is the UK graphic. Now, you're probably familiar with this now. The excess deaths here in blue were from COVID, of course. We expect that. The dotted line is the 5-year average we would expect. And if we look at the most recent situation here, which I can, yeah, there we go. This is the most recent situation here. So what we're seeing is this is the 5-year average. These are weekly bars. This is the 5-year average. These are data dropouts, of course, for bank holidays and such like. These are the COVID deaths. So all these deaths in green above the 5-year average are unexplained excess deaths, to the tune of, in the UK, 1,719 excess deaths in the UK in a week. This is, to me, this is huge, and people don't seem to be talking about it too much. Now, just before we finish, we'll look at some UK data from the official website. Let's go with healthcare first of all. So, thankfully, we are seeing the numbers are starting to go down. So these are patients admitted to hospital here, and if we look at the last, that's the last 6 months. So that's the last 3 months. So we are seeing a reducing trend. People actually, they're the breakdowns by age. Obviously, I put the link to this site. Patients in hospital, again, thankfully, in the last month, we are starting to see a downward trend. Last 3 months there, it's more obvious. Obviously, it takes time for the people to be discharged because some will be retained due to complications. And people on mechanical ventilators, well, that was when we noticed that went down dramatically when Omicron came along. So that's kind of the start of the year there. It went down, and thankfully it stayed down throughout the Omicron era, way lower than it was in previous waves. That's the data for the last year. So basically Omicron came along about here, and since Omicron came along, it's done nothing but go down with a few. Okay, there's been very large numbers of Omicron cases there, and even though Omicron is sending far fewer people to the intensive care, the sheer numbers of people getting infected in this time period, in this era, meant that there were some admissions, but way lower if we look at that in the context of the whole pandemic. Deaths in the UK, as we've said, not gone away. Let's look at death certificates by date of death. Well, we're still rumbling along at this low level. I mean, nothing like we were in the peaks. These are COVID deaths, of course. This is the weekly deaths with COVID on the death certificate by date registered. So again, we saw the peaks and we are a lot lower. So these are saying when. So the last one there is 532. Not necessarily they died from COVID, but COVID was involved in that death. But many of those would be dying with COVID, not necessarily dying from COVID. So there we go. I'm gonna look at the this excess death figures. Really, it's 1,719. It's huge, and similar situations in Europe. We really need answers to this. So anyway, pandemic-wise, drifting very slowly into this period of endemicity, which I'm afraid is going to be with us for some time. Big unknown for the winter is influenza. That could potentially kill quite a few people over winter. We don't know how that was going to shape up yet. It's looking not too bad so far, but I'm fairly confident from this data that COVID's going to keep drifting down at least till midwinter. We can't really say what it's going to do next January, February. We really can't say that. But from the data we have now, I think we can, not with confidence, but with a degree of expectation, I think we can hope that it's going to keep drifting down for November, December. We shall see, and thank you very much for watching.